You're listening to Just Medicine, an equity in healthcare podcast created by medical students in British Columbia.
Hi, everyone, and welcome to the third episode of our podcast series, where we continue to explore the critical intersections of healthcare, community, and connection. Today, I'm grateful to be joined by Dr. Morgan Lindsay, a dedicated family physician practicing here in British Columbia. In this episode, we delve into the challenges and rewards of providing high-quality care in family medicine, especially in a climate where burnout is an ever-present risk. Dr. Lindsay shares invaluable insights on the importance of maintaining representation of Indigenous people within the healthcare system as healthcare providers. We discuss strategies for retaining these essential voices in medicine and explore how family physicians can develop the skills necessary to support patients who have been historically underserved or even mistreated by the healthcare system. We also talk about the broader role of a family physician, going beyond the exam room to ask deeper questions about why a patient might be considered vulnerable, and how understanding the social determinants of health can guide more effective advocacy within systems that often perpetuate these inequities. Finally, we revisit the important topic of food and diet, with a focus on the power of connection. Dr. Lindsay discusses how colonization has disrupted Indigenous peoples' relationships with their traditional lands and communities, leading to numerous health challenges, and how restoring these connections is key to healing. This podcast episode fits into the broader series, which focuses on the role of food in healthy and culturally appropriate diets for Indigenous populations to facilitate a healthy gut microbiome. So far, I've spoken with Jessie Newman, an Indigenous health dietitian on Vancouver Island, and Dr. Estelle Knapp-Hill, a gastroenterology specialist in Vancouver. These conversations provided valuable insight into the significance of food and food systems in Indigenous communities and how diets have evolved over time. As well, the composition and factors that shape the gut microbiome and how a thriving gut microbiome facilitates positive health outcomes in patients. If you haven't listened yet and you're interested to learn more, I highly recommend you go check out those episodes. But now that we've laid the groundwork, join me for a thoughtful and impactful conversation with Dr. Morgan Lindsay as we explore how to care for our communities with compassion, awareness, and resilience. Welcome, Dr. Lindsay. It's fantastic to have you on the Just Medicine podcast today. Thanks so much for being here.
Thank you for having me.
Of course. I can't wait to get to know you more through our conversation today and delve deeper into your experiences and expertise. So without further ado, let's get started. Dr. Lindsay, would you mind introducing yourself to our audience?
Of course. So my name's Morgan Lindsay. I'm Métis Cree on my dad's side, and we're members of the George Gordon Cree Nation in Saskatchewan. And we also have Métis roots in the Red River Valley. On my mom's side, I'm from a family of settler cattle ranchers and cowboys from Alberta, originally of Scottish descent. I was born on the territory of the Lekwungen-speaking people on Vancouver Island, and I've lived most of my life on Coast Salish territory. And I just want to mention that for people who aren't used to introducing themselves in Indigenous spaces, it might seem like sort of a long-winded introduction, but it helps us to make connections with each other, sometimes even find common ancestors and experiences, and helps us connect to our traditional territories.
Definitely. Thanks so much for sharing that. And thanks for sharing a little bit about who you are with us. One more thing that I just wanted to ask you is, what's your favorite food?
Ooh, I like this one. So I have a bit of an obsession with gardening. And my favorite summer food is raspberries and blueberries right from the garden. But in the winter, I would say it's pizza.
Delicious. We actually near my family home have blackberry bushes in the alleyway. So I'm on
Oh,
that same wavelength. We've got raspberries in our backyard, blackberries in the alley, and love
nothing
to
like
pick them.
berries in the summer. Yeah.
Yeah, nothing like it. So what inspired you to pursue family medicine, and what was your path to becoming the family physician that you are today?
So basically, I just love the breadth and the variety in family medicine. I love that I can work with my hands doing a procedure, but also support people with their mental health, do interesting diagnoses. I just love all of the different things that I get to do. Actually, growing up, both my parents were social workers, so I grew up in a home where social advocacy was the norm. And I also like that this work gives me an opportunity to support my patients more holistically, I think, than I could in another specialty. In med school, I actually really loved emergency medicine, and considered doing that afterwards. But I just loved everything else too. So I ended up doing quite a lot of rural ER work earlier in my career. Um, I did the UBC residency at the Indigenous site and finished residency in 2009. Um, and after finishing residency, I did locum work for a few years up north, landed in Nelson, BC, where I worked for several years, and then moved back here to the island in 2017. Currently, I do locum work here in the Cowichan Valley, and I also work with the First Nations Health Authority's Doctor of the Day service. And I'm also co-site director for the UBC Family Medicine Residency Indigenous site.
Wow. So it sounds like you've had a wide range of experiences and you have a lot of different responsibilities working in the clinic and then also sort of that more administrative role through UBC.
Mm-hmm.
Wow.
Yeah. Yeah,
So
lots of different things, so many different opportunities within family medicine.
yeah, definitely. And when you were working more rurally, doing more emergency work, did you do a +1 for Emerge or was that just within your scope of practice
No.
at the time?
Yeah, I did do quite a few emerge electives during my residency. So I felt, you never feel truly prepared at the end of residency, but I felt ready enough. And then, yeah, was able to gain some really good, fairly well supported experience in my first couple of years in practice. But yeah, I never did the extra training after residency.
Right. Well, that's fantastic. I guess if you have the confidence and you have the expertise, you're probably contributing really meaningfully to those communities. So
Well, and
that's awesome.
once you get into practice, you sort of learn like the whole call a friend thing is real, right? The phone is like such an important resource, and knowing who you can call. Um,
Totally.
so yeah, I was lucky there to have good support.
Yeah. Teamwork makes the dream work.
Right? Yeah.
Awesome. Well, thank you so much for that introduction about yourself as well as your career path. Transitioning into the next section of the interview, I wanted to delve into the topic of protecting the health and safety of Indigenous patients and Indigenous physicians, specifically Indigenous family physicians. So, as an Indigenous physician, having worked a significant amount with urban and rural Indigenous communities, I'd like to just start by discussing your experiences with racism, discrimination, and burnout, and in particular, how these factors impact the care that Indigenous folks receive. So, sort of just starting with a question, why do you think it's so important to have BIPOC representation in medicine?
Yeah, great question. And I think there's so many reasons, and you may get slightly different answers depending on who you speak with. So, I mean, I speak only for myself. But as we know, Indigenous people, Black Canadians, and other racialized groups still experience health disparities in Canada, including issues with access to healthcare, as well as gaps in health outcomes. Having more BIPOC representation in healthcare helps everyone, I think, understand and address the barriers that people from racialized communities face. It can help patients feel safe and facilitate access to healthcare that might otherwise feel unsafe.
Mhm.
Um, we also know there's a terrible history of unsafe healthcare in Canada, including Indian hospitals, non-consensual health research conducted in residential schools. And I encourage people to read up about this part of medical history because I think it's really important if you're going to be practicing in these spaces. And there's also ongoing racism in many healthcare settings, which can lead to misdiagnoses, morbidity, and mortality. And the Truth and Reconciliation calls to action recognize that having more Indigenous representation in healthcare is important, as is the retention of Indigenous healthcare providers in Indigenous communities. Um, also, I think it's, kids all deserve to see themselves reflected in the healthcare workforce, so they know it's an option for them.
I'm curious, just to expand on that a little bit, how you think we can increase representation, specifically, I guess, for Indigenous physicians in the healthcare field.
Yeah, I mean, I think a lot of good work is already happening in terms of, starting with kids in high school and having them exposed to, science education. I don't know if it's still happening, but there was this cool mini med school camp that used to happen at UBC. And just, making sure that they know that this is an option. And then from there, yeah, continuing through with undergrad students. And then once people are, have sort of selected a profession, to have supports in place so that they can continue. Because often, I mean, for everybody, but particularly for Indigenous people, possibly coming from different communities, it can be like, really sort of different in an uncomfortable space to be in those learning environments. So just starting to, yeah, just to listen to the people who have been through it, and to give them more support as they move through.
For sure, removing the barriers to pursuing that type of
Exactly.
education, for sure. Um, as for our next questions, so you touched on how representation is super important to creating an environment that feels safe for Indigenous patients. Could you also just walk us through your approach to providing healthcare for particularly vulnerable populations?
Totally. Yeah. And I like this question a lot too. So, first off, I think it's important to use a lens of trauma-informed and patient-centered care for everybody. So, often you'll come to a patient encounter and you don't know what somebody's history or experiences have been. So using that lens from the get-go. And this is especially going to make a difference when we're working with people who have experienced discrimination within the healthcare system. Yeah, I wanted to touch just briefly on like the term vulnerable and what that means, because I think we're actually talking about people who have been either not well served or outright mistreated by the healthcare system. And this isn't just like, a few individuals working within the healthcare system, but it's the way the systems are built. So I just think it's important to kind of think about why people might be labeled as sort of quote vulnerable, why they might be at higher risk for severe illness. So often, we talk about the social determinants of health, poverty, drug use, lack of housing, education, etc. But really, there's deeper layers there, and it's often childhood trauma, it's disconnect, it can be colonization, racism. Yeah, and to get into answering the question, I think working with people who aren't being well served by the healthcare system, there's a few important things to remember. And the first thing is really meeting people where they're at, because I know in med school there's just like so much to learn. There's all the pathophysiology, the pharmacology, the diagnosis, et cetera, et cetera. And then, we get out in the world and we want to use that knowledge to help people. And that knowledge is important. But sometimes like the most therapeutic thing we can do is sit down with somebody, right, and hear their story. And then from there, once you understand a bit about who they are, where they're coming from, their priorities, it might be, yeah, like they need the latest antihypertensive. But it might be that you, like you said, discover barriers to care that need to be worked through first.
I'm curious when you say that, it sounds like spending time with somebody is important. As a
Yeah.
physician, there can be
Yeah.
barriers on how long appointments are, and I was wondering how you
Mhm.
navigate that.
Yeah, and I think it's probably going to come up later too, but I think it doesn't necessarily have to be a significant amount of time, right? I think like people know when you're paying attention, right? And when you're listening, and asking sort of clarifying questions, and sometimes too, like yeah, it might be a bit more time. Fortunately, as family physicians, we get to know people over time. So it doesn't necessarily mean, we sit down and hear somebody's life story in the first visit. But I think, yeah, people pick up on that openness and that curiosity and really wanting to know them as people. And it is a balance, right? Like, quite honestly, I've found I much prefer working in environments that aren't fee for service, where I do have a bit more time, right? Like, it's common now and in a lot of these places I work that we do have 20-minute, sometimes 30-minute appointments rather than, the 10 to 15 that I got used to in the fee for service system. So there's some things that are getting better.
For sure, for sure. And you're right that you could show somebody you're listening and you're interested and you're curious within a very short span of time, as long as you are, it's not a fake it
Right.
till you make it. It's a make it and
Yeah.
make it and
Yeah.
asking the right
And it's
questions.
experience too, right? Like, yeah, it is. I mean, me personally, like, it took several years in practice to really feel like I was keeping up in the day. And sometimes still things go awry and I'm way behind. But, sometimes, like often, you'll get information that you just wouldn't have otherwise. And then that's going to actually make the ongoing relationship and the ongoing work much easier.
For sure. For sure. Um, During your day-to-day, I'm curious, do you work interprofessionally with other health providers? Which health providers? And what do you think the value is of working in a team, especially for the populations that you work with?
Yeah, and I'm not sure if I mentioned earlier, but I previously had a small practice, but currently I'm doing locum work exclusively, as well as this administrative role with UBC. So I work in a few different places, but generally I always feel like I'm most effective as a physician when I work as a team. So, like you mentioned, a lot of people have barriers to medical care, and there's often other healthcare providers, allied care providers who are better placed to help address some of those barriers. So I've worked in a few different teams, often with nurses, sometimes with counselors. I've worked on a couple of different care teams that include social workers, and they've been amazing at helping people access things that are pretty fundamental to their well-being: housing, disability income, sometimes food boxes. And then once those things are in place, it just becomes much more feasible for people to focus on their health. I've also been really lucky to work in a couple of different healthcare teams that include Indigenous elders and knowledge keepers. And their knowledge and experience and just their ways of relating to people are pretty incredible to witness, and can be really beneficial to patient health, and I think also to the health and the wellness of the healthcare team.
For sure. And have you noticed that that's common for family physicians to work with Indigenous elders and knowledge keepers, or was that something kind of unique at the time that you were doing?
I think that was pretty unique because it was really like nation driven of like with the nations I was working with. I think it is getting more common now for family docs to work directly with different allied health, right, in healthcare teams in BC. I think we were a bit behind on that, but we're getting better now, and the system is getting better in supporting us to work within those teams.
That's fantastic. Yeah. Yeah, you need the system to sort of be on board, I think, a lot of the time in order to make those sorts of collaborations possible. So, especially
Yeah.
on a wide scale.
Yeah, yeah, totally.
Yeah, so it sounds like working in a team can facilitate creating a safe space for people as well as supporting each team member along the way to creating that space. So, thank you so much for exploring that. I'd like to transition now from speaking about the clinical aspects of your work to now speaking more about the aspects of your work that relate to health research. The next question that I'll ask you is, how can physicians maintain trust with patients and communities who have historically been seriously harmed in the name of clinical practice and research?
Yeah, and I like this question a lot too, because I think we all want to be trusted, especially as people who've kind of dedicated our lives to learning how to care for others. And for some patients who have had good experiences, we might be, implicitly trusted as a doctor, which is quite amazing. But for other people, it can take a long time. So there's a couple of things I'll talk about. And I think on the surface it's pretty basic, but I know can be kind of easy to slip up when you're in the middle of a busy day. So the first one, and we talked a bit about this already, is listening. And again, it doesn't mean every appointment has to be an hour long, but being present and, as that relationship builds with the patient, it's going to make your job easier. It helps the patient feel heard and it builds trust. And yeah, to not take it personally if somebody doesn't trust you right away, because you can get there. It just might take a little extra time. Another huge one is doing what you say you'll do. Again, pretty basic, but this is small things as well as big things. Like if you say you're gonna send a lab requisition or do a consult, like do it, or talk to them about why not. If you need time to find an answer or a diagnosis, be clear about that and then go after the answers and come back to people, because for people who've had their trust broken in the past, following through is a really big deal.
Mm-hmm.
And the third thing just has to do with involving the patient at every level. And again, pretty basic, but it can be, in the day-to-day can be harder to remember to do. One example is it can help to briefly explain why you're asking sensitive questions. I recently had feedback from a patient that they felt judged when another physician was asking them questions about their drug and alcohol use. And really, I mean, these were questions that every physician should be asking in the context of the patient's symptoms. And I explained that to the patient and they did feel reassured, but I think the whole upset could have been avoided with just a little, brief explanation. So it could be something as simple as like, I have some questions to help me figure out why you're having these symptoms. They might be uncomfortable, but it's useful information. Or these are questions I ask everybody with X symptom. Or even, asking permission to talk about what might be a sensitive topic if it's something the patient hasn't brought up. Like, is it okay if we talk about diet and nutrition? It may, it may be totally fine, but it may actually be a sensitive topic for people who have experienced weight bias. And I know I've forgotten at times that, things that feel so routine to me as a healthcare provider can be like, yeah, just a little bit out of the ordinary and sometimes upsetting for people. And then, of course, involving the patient also means just checking in, various points in the visit, make sure you're on the same page, and then inviting questions, especially towards the end of the visit. And I'm often pleasantly surprised. Like I sometimes get that like feeling like, oh, do you have any other questions? And you're like, oh no, it's going to lead to like, but just knowing like, do you have any other questions about what we've been discussing, right? And usually if you've kind of been checking in, there might be like one more question, but yeah, I think it's worthwhile to do that in a visit.
Right. And like you say, setting expectations, you can ask, do you have any other questions? We might have to address them at the next visit.
Totally.
We
Yeah.
may not be able to get into them today, but I'd
Yeah.
love for you to share what you're thinking.
Exactly.
So,
Exactly.
yeah, that makes total sense. And to preface before you ask sensitive questions that there is a reason for it, as opposed to backtracking later on, because you can't
Right.
unsay that sensitive question. You can't make people unfeel those feelings of discomfort that you may have caused. So
Yeah.
that makes total sense as well.
Mhm.
So, thank you for sharing your wisdom on those topics. I'm hoping now to transition to talking about the health and safety of Indigenous physicians so that they can provide high quality care as well as feel that they're supported.
Totally.
So, the question that I'm going to ask specifically is, could you talk to us about your experiences in medical school, then working at a clinic, whether that was your own clinic or as a locum, as an Indigenous person?
Yeah, for sure. And I do want to say, because we're just on a podcast, not a video, that I'm of mixed ancestry and I'm fairly white passing, depending on who it is. People often from my own community will definitely recognize my mix. But I think the fact that I know the fact that I'm white passing has made it easier for me to move through the world in a lot of these sort of medical spaces than someone who's visibly Indigenous or Black, for example. So yeah, again, like I only speak from my own experiences. Um, yeah, I mean, part of it is positive, right? Like I have some shared experiences with other Indigenous people, which I think just helps us understand each other, communicate more easily. I love working in Indigenous communities, and part of that is a shared sense of humor. So that's been, yeah, like just a really fun part of my work. Thinking back to medical school, one thing I remember finding difficult was witnessing, outright racism and sometimes, quieter discrimination, and not really knowing how to confront it in that moment, or really how to process those experiences later on. So I was almost always the only Indigenous person sort of on a care team or on a rotation. And I saw, Indigenous patients struggling against systems that were not built for them, systems that discriminated against them. And I felt pretty powerless to kind of change anything. You're sort of in a particular position as a learner and someone being evaluated as well. Um, and I think, also being white passing, I think I witnessed some comments about Indigenous people from other healthcare providers that they may not have said otherwise. And I had to learn how to sort of address this gently with people just from my own mental health, right? Because yeah, it's hard to be in that space and not kind of have an outlet to talk about those things. But eventually I did connect with other Indigenous physicians and nurses, Indigenous nurses as well, who could relate. And this was a huge protective factor for me. So there's a lot of people that came before me, that sort of are like, trailblazers is such a like cliche term, but yeah, really kind of helped make things easier for those of us coming later. Um, I know, sort of like I mentioned, like bearing witness to trauma, which happens in healthcare all the time, can really have a negative effect on mental health if you don't have outlets to debrief with others and get support. So yeah, that making those connections was really important and valuable for me. And I still have a lot of those connections, like 15 plus years later.
Wow. Yeah, that's fantastic to have close connections with people who have those shared experiences potentially, or who you can talk through those experiences with and feel can understand where you're coming from. And I can
Mhm.
imagine the burden of witnessing these traumatic experiences for patients or for other Indigenous physicians, and feeling that you need to speak up as another Indigenous person and feeling alone in that burden could be
Yeah.
really challenging.
Yeah, and I think these are experiences, like trauma in the healthcare system is not unique to Indigenous people either,
Mhm.
right? Or to Indigenous healthcare providers. So, I mean, I don't know if things are different now than when I went through school, but just forming those connections with other residents and sort of having a little method or way of debriefing, I think is really important.
Yeah, definitely. We actually have a program in our first year, potentially our second year as well, called Healer's Art, which is sort of like a forum for discussing your experiences, discussing the feelings you've had around those experiences, even creative outlets. We had drawn images of characteristics that we thought we have left behind before we came into medical school, and how we can reintegrate those characteristics into our identities as medical professionals. And we were able to debrief those creative outlets with other students in a very like private and safe environment. So there are some programs that exist like that, in different contexts with throughout school, which is really fantastic.
Yeah, that's great.
Yeah, it's good practice.
Yeah, and those, I mean, it may not look like that when you get into practice, right? It might be something totally different, but yeah, just to keep those sort of conversations happening.
For sure, for sure. Now, my final question for you is, can you summarize how we can keep Indigenous health professionals who are more likely to work in underserved communities and contribute significantly to vulnerable patient care in the workforce?
Yeah. And I think we sort of mentioned also recruitment. I think I like this question because I think there's been really huge strides in recruiting more Indigenous people to health professions, and that includes medicine. But there's not just been as much effort in or understanding in how to retain us in these roles. And I think most of the things that are helpful for retaining Indigenous health professionals are going to be the same as for non-Indigenous. Like, we talked a bit about multidisciplinary teams, which I think is huge. Less administrative burden, like getting compensated adequately, like reasonable on-call expectations. So all of those things I think are pretty universal. And then, specific to Indigenous healthcare providers, it's really helpful to have access to Indigenous specific mental health supports like elder support, Indigenous peer supports, land-based healing, which I could do a whole other podcast about, and then time to connect with community, right? Often people are away from their communities for training and then for career, and just having that space to reconnect physically, I think is really important.
Mhm.
I also want to acknowledge how difficult it can be to work in one's own community. And often that can just feel too close, if that makes sense. And, even though there's huge variation across Indigenous nations, I think as Indigenous healthcare providers, we don't necessarily have to work in our own community to improve healthcare for Indigenous people. So yeah, just something to think about.
Yeah, definitely. Thank you for sharing that. With regards to the land-based healing, you mentioned you could do a whole other podcast episode on
Yeah,
that.
yeah.
I'm just curious, is there somewhere that listeners or myself can go to learn more about land-based healing? Are there any resources that you can
Yeah.
recommend?
I mean, honestly, I don't have something off the top of my head. We'll talk a bit more about food as well. I know like FNHA has some great resources. So if you just Google like First Nations Health Authority and land-based healing, there's some stuff there. Just learning about what might already be going on locally. Um, you know, there's programs kind of happening everywhere, and there's a lot of variability in those. Some cool stuff happening within like the addictions medicine and mental health space, but also just yeah, I mean there's different approaches, like non-Indigenous approaches and stuff out there. So yeah, I mean, I don't really have something off the top of my head, but definitely there's a lot of good info. And then I think like the best resource is like just going outside and experiencing it for yourself, right? Which is again hard to do in the busy time of training, but yeah, really therapeutic.
Definitely. Okay, thank you for those recommendations. So moving now into the kind of second half of our podcast episode, like you said, we're going to start kind of delving deeper into food and diet. Um, I did want to remind listeners that this podcast series looks at the intersection of diet, the gut microbiome, and food sovereignty. So during this portion of our conversation, I would also like to explore the importance of food for health and wellness and how to address this, especially for Indigenous folks. So to start us off, maybe just provide a bit more context, if you wanted to add anything to what you've already said. What is your role as specifically a family physician in addressing the social determinants of health, perhaps compared to other specialties or allied health professionals?
Yeah, and I really think as family docs, we have a leadership role in addressing social determinants of health, because most often we're the ones who know our patients over time, right? We get to know their lifestyle, their work, their families, and their communities, which just makes it easier to kind of understand what's going on, and then also to know about what's available in our own communities. That's something that can be challenging to keep up on, but we're also part of communities where we work. So yeah, I think family docs have a really important role. Specialists often just don't get the chance to get to know people like we do. And then also, again, involving allied health providers when we can is really important. Another thing, sort of what this podcast touches on, is we're in a position to advocate for our patients' health in big and small ways. So, that might be like writing a letter on behalf of a patient. It might be more at a community level, getting involved with physician or community groups, that sort of thing. Yeah, because it is, I mean, there is, for better, for worse, often in, government and other professional spaces, there's respect for our profession, which, can be a really great tool for us.
Right, for that advocacy piece.
Mm-hmm.
Yeah, so I appreciate you delving into a few strategies that family doctors can use to advocate for the holistic needs of their patients, especially given that myself and many of our listeners are early on in our careers. It's great to kind of be aware of these tools. Now, obviously, our goal as medical professionals is to promote health and well-being. What does a truly healthy community look like to you?
Yeah, I could do a whole other hour on this too, but I won't. Because I think a healthy community is one where, there's adequate access to land, water, culture, healthy food. More generally, one where people look after each other, where people aren't isolated from each other. Where people have access to primary care, to mental health services and specialty services when they need them, where elders and youth are respected. And yeah, basically one where we acknowledge like the connections, like all the connections between us, we're all connected. And that's kind of a bit dreamy, but yeah, I think health is so much more than going to the doctor.
Absolutely. And I think the word connection is central to our conversation and these issues at large. That's a key concept, and not just connection being human to human, but also human to nature, human to land, human to spirituality, and more. So I love that you brought that up, and I agree that it is foundational to health.
Mm.
So getting more specific, sort of again, moving more into the food diet conversation, could you please tell us more about how food is a determinant of health for the communities you work with?
Yeah, so I mean, obviously food is nutrition, but it's much more than that. As a bit of a background, I mean, I think we probably all understand that colonization and the Indian Act reserve system had a hugely negative impact on Indigenous people's access to healthy traditional food. And then because of colonization, a lot of Indigenous people experience poverty, don't have access to whole and healthy foods, and that includes traditional foods. Um, we know, kind of the basics in general. Whole foods are going to be a lot healthier than processed and packaged foods, but unfortunately, particularly in urban areas, and in the north, it's often the processed foods that are what's available, and what's affordable. For example, where I work here in Coast Salish territory, specifically Kwetson or Cowichan territory, there's some amazing healthy traditional food like salmon and other seafood. There's a lot of people working to preserve traditions around food harvesting and food preserving. And for a lot of people, like hunting and fishing, gathering food is a like a year-round way of life, but not everybody is able to do that. There's food fish distribution that happens every year through the largest First Nations here, for elders and others in the community. But the reality is to go to the store to try and buy this kind of food at the store is cost prohibitive for most people.
Right. And is it difficult to access traditional foods? Would traditional foods even be available at your average grocery store.
Yeah, totally. And I was going to mention at some point there's a Indigenous chef who lives here, and his name's Quistenixon. I always have trouble, of course.
Jared.
Yeah, Jared. Yeah.
Yeah.
So he talks a lot about that and about some challenges in trying to like actually have like serve traditional foods and kind of all the rules and stuff that go along with it. But yeah, I mean, it is really cool to live in a place where there's, a lot of awesome food and then a lot of stuff kind of happening around keeping those traditions going.
Definitely. And definitely probably more to be done to keep those traditions going, make sure that those traditions are being passed, down to the younger generations and creating those connections again.
Mhm, mhm.
Sure. You provided a example of change from a more traditional to a more westernized food consumption. Are there any other examples you could share that would illustrate the evolution of diet over time in the Indigenous communities that you've worked with?
Yeah, well, one thing that just sort of comes to mind is like just the pretty stark difference in like carb content of a lot of the food that's easy to access and more affordable and filling now, like a lot of this like bread and pasta and sugary things and potatoes, which I'm a total believer, like everything in moderation. But it's kind of come at the cost of like whole fresh foods, of foods with more healthy fats. And that's definitely, yeah, makes a difference for health outcomes.
Right, definitely. Could you discuss what kinds of factors have impacted dietary choices for your patients? You've mentioned geographical location, but what about things like socioeconomic status or education, culture, things like that?
Totally. Yeah. Yeah. And I mean, I think we kind of touched on it, but I just wanted to like highlight too, and maybe this is this coming later, but like there's so many reasons that food is important. One thing I talk a lot about with my patients who are able to go and access traditional foods is that, you know, that keeps us active, right? So hunting, fishing, traditional agriculture, foraging, we're kind of forced to be outside, to be moving, and then also it's, as you said, connecting us to culture and to our families. Um, Food's a really important part of community gatherings, of ceremony. Um, yeah. So in terms of factors that impact dietary choices, I mean, again, like income is a big one. Education, culture and upbringing, your location, right? Whether you're rural or urban, these all affect dietary choices. For a lot of people, again, both Indigenous and non-Indigenous who have experienced complex trauma or a lot of childhood trauma, they might just be in survival mode like all the time and not really have the energy or the resources to change how or what they're eating at that given time. On the other hand, for people in nations with a lot of self-determination, nations who have management of their own food systems, they might have really great access to traditional foods. So this can impact food choices, in a way that leads to better health outcomes.
Yeah, definitely. Dr. Lindsay, just being mindful of time, I do have a few more questions to ask you regarding diet planning and next steps when it comes to addressing food access as a determinant of health for patients coming to see a family doctor. So, one of the last questions that I will ask you is, as a family physician, is it common to prescribe diets to patients? And do you have types of diets that you commonly prescribe? If you wanted to, could you touch on barriers to patients following these diets as well?
Yeah. And I think, unfortunately, education on nutrition is really variable across medical schools, fairly lacking. I don't know if this has changed much since I was in school, but it's, pretty fundamental part of health and well-being. And as physicians, we mostly kind of have to do our own learning around nutrition. And I know there's some data on benefits of like quote unquote prescribing certain diets. Honestly, I don't really see it happening that often like that way. We do often refer people to dietitians for nutritional advice, excuse me, especially related to certain medical conditions. Diabetes nurses are another great resource who do a lot of the nutritional counseling and planning. In my practice personally, I talk to people more about choosing whole foods, about accessing traditional foods and general approaches to healthy eating, and what's going to work for them more so than I prescribe any particular diet.
That sounds like a great approach, and it brings back that collaboration with the patient themselves, allowing them to
Yeah.
have that freedom of choice around what they're actually choosing to eat as long as they've got this broad, quote unquote, prescription in mind.
Right. And sometimes they'll need more help with the specifics, but then where they're at and where to go from there.
Definitely. So it's evident that diet improvements are needed, and perhaps there's a system-wide transformation that has to happen to improve access to healthy foods and access to the land where traditional foods can be harvested and things like that. I'm curious, how do family physicians advocate for healthy food access for individual patients, and what does that look like more at a systems level?
Hmm. Um, and yeah, I mean, I'm still learning about this for sure. I mean, I think we can support our patients by helping them access, income and benefits where they're eligible. No, nobody loves paperwork, but there are, disability benefits. There's some limited government nutritional benefits that don't get people a lot of money. They have limited eligibility, but it's something, and it can make a big difference to people with limited resources. And I think, it's actually a really important part of our job to help people, to sort of treat the poverty where we can. I think, depending on your educational background, most of us need to educate ourselves about nutrition and about the barriers people can face. And then at a more systems level, personally, I think we all need to support local farmers and food programs, um, food security nonprofits, and particularly Indigenous-led organizations. And we can also support Indigenous movements for land and food sovereignty.
Perfect. Thank you so much for sharing that. I think that's important guidance for physicians and for medical trainees, because once you know that, you can start to contribute meaningfully to those programs and projects and continue to help
Mhm.
them grow as well.
Yeah. And to kind of know like the resources, I mean, it depends on where you are geographically, right? But to kind of know, is there a food bank in your community? Where are they located? I mean, for a lot of First Nations, they may have their own sort of food box service or, food program for elders. There might be community gardens. So yeah, talking to people and just getting to know kind of what's available.
Of course, that's great. So we're coming very close to the end of the time that we have together today. So I will ask you one final question. Is there a book, podcast, or other resource that you would suggest for trainees interested in learning more about what we've touched on in our conversation?
Yeah, I mean, without going too far down the rabbit hole, I think it just, I sort of mentioned before the FNHA, the First Nations Health Authority website has some great info. So you can just search FNHA and food security or food sovereignty. I'll mention Questenixon again, Jared Williams. He has a YouTube channel and he has a couple of really great TEDx talks. So go and check those out. And then finally, I just always encourage people to know their own history, to know their own ancestry as best you can as part of building cultural safety skills, as well as learning about the nation whose land you live on. I mean, we all have biases and assumptions. We just need to kind of understand what those are before we can address them. And yeah, and learn about where your food comes from.
Absolutely. Well, that's great advice. And thank you so much for everything you shared during this episode, Dr. Lindsay. I know I really appreciated everything we spoke about. It was very informative and inspiring, and I hope that our listeners feel the same way. So, with that, we'll wrap up the episode here.
You're welcome. Yeah, that was a really fun chat. And yeah, it's really great to know that upcoming med students are interested in this stuff. And I look forward to meeting future colleagues.